10 to 11 a.m. Mondays through Fridays every day. We have specialized health practitioners who come in to consult, basically advise us for free on radio. My name is Fumi Babala, and our radio doctor today is Dr. Ewana Watemidiri, Senior Registrar in Obstetrics and Gynecology at Lagos Island Maternity Hospital. He's also the first Vice Chairman, Nigeria Medical Association of Nigeria in Lagos State. Good morning, Dr. Ewana. How are you, sir? You are muted. You've muted yourself.
Okay, okay. Can you hear me now?
Yes, I can. How are you?
Good morning for me, and good morning, Nigerians. Glad to be on air again.
It's good to see you. It's good to have you. The phone lines will be open shortly, and you can send your texts from now 0703 1756 537 or 08155 917 917. We are live on YouTube at WFM 917. And you can listen to us on the go via our website, www.wfm917.com. Okay, we are going to get into it. Today's topic is pretty simple: family planning and contraception, making informed choices. You already know that when we have Dr. Wano, we're talking about conception, all things affecting women, basically. So we are going to continue in that line. Dr. Wano, could you explain what family planning means from a medical perspective, from a public health perspective, and why it is important for couples, for individuals, for communities, for women, for families? Please go ahead, sir.
All right, thank you. Can you hear me?
Yes, I can hear you.
Thank you very much for me. Family planning simply means deciding. I will try as much as possible to break it down so that we can all be on the same page. So
Okay.
family planning, by simple definition, refers to deciding by a couple on when to have children, how many children they want to have,
Yeah.
and spacing the pregnancies in a very healthy way. Now, it's actually very important because it will help the couple, to prepare emotionally, physically, and even financially, before they start having the children. And of course, it helps them to protect, and it will also, by extension, it will help to protect the health of the woman and that of the baby if they actually go about starting family planning. So in short, it means that the couple have decided on when to have children, how many children they want to have, having in mind that they need to space these children. That is
Mm-hmm.
what family planning is all about.
Okay, thank you so much, Dr. Wano, because a lot of people don't know what it is. But why is it important for people to make informed decisions about when and how many children to have? There's some there's some people from different, maybe churches, mosques, religion, basic faith, people of faith who don't believe in family planning, and then they have children back to back, regardless of whether they can take care of them, regardless of whether they have the wherewithal to provide for them, buy food, buy clothes, send them to school. So why is it important for people to make informed decisions about when to have children and how many children they should to have, basically?
All right, thank you very much for me. Yeah, it's actually very important for a couple to actually, plan their families in terms of the number of children they want to have and when they want to have these children. Now, this is because it will help them to make sure that they are ready to take care of these children
Yeah.
properly. Because it's just enough to say you want to have children. You should be ready to take care of these children properly. Planning also helps the mother to avoid having pregnancies that are too close together. Because there's even a recommendation by the World Health Organization, ideally, the interval between one pregnancy and the next pregnancy should take a minimum of 18 to 24 months. So when you plan this pregnancy very well, because that woman needs to recover from the previous pregnancy before the next one. Otherwise, it has health implication or adverse health implication on the mother and the next baby. So by
Mm-hmm.
planning, that's by the family planning, it simply means that you can have children that you can adequately cater for And it also helps you as a mother to avoid having pregnancies that are too close together. Because the implication of that is that having pregnancy at a successful interval, very close interval, can have you know, health implication on both the mother and the baby. So it's important that the pregnancy is actually well planned for these reasons.
Thank you so much for that. I'm just going to preempt myself because when you said the when you were talking about what happens when the mom has given birth and the next one, but a lot of men, let me put it that way, don't see that way. They're like, oh, let's give birth back to back without really fully understanding the health implications for the woman. We've seen a lot of women who've gone to the hospital and the doctor has advised them, you can't have another baby because this baby that came out, maybe the woman had vaginal birth. And I said, this baby, you had maybe you gave birth to a 4 kg baby, maybe there were tears, maybe there were complications. Maybe it's advisable for you to stay off having children for now, or maybe they had a cesarean section, it's advisable. And then there's that friction in the home because the man is like, no, but we say we're going to have 5 children back to back and we must have those children back to back. How do you strike a balance there, or what would you say is the solution in that kind of situation?
No, get that. I didn't get that again. Can I take
Okay,
that
i
again?
was i was asking based off of what you just said. There are a lot of women that have been advised to not have children, to take a break, maybe a 1 year break or an 18-month break after they had their first child or maybe their second child, based off of the complications that they experienced. But we find that a lot of men, or sometimes even the women, don't take this advice to heart, and then they get pregnant, and then we're seeing something more uh, life-threatening than expected. What is the solution here? How do we get them to realize that, look, this thing is actually for your health and well-being, as opposed to you just want to be giving birth because that's the plan for your family?
All right. Thank you very much. It's fair enough. You see, because if you're talking about family planning, essentially you are not dealing with the woman alone. You are dealing with the couple. So by family planning, it will help in so many ways. And that is why a woman, for example, intends to get pregnant maybe 6 months after the next one or the year after the next one, who now engages in family planning, got a lot to learn from that. Because with family planning, it will allow women to rest and to recover between pregnancies.
Yeah.
So it will allow that woman to rest and to recover between pregnancies, which will keep the woman to now be healthier. In fact, babies who are born after proper spacing are also more likely to be healthier. Because imagine a woman that has not recovered from previous pregnancy and she now gets pregnant again. Maybe she has some blood loss, she has some degree of blood loss, and she has low blood level, what we refer to as anemia. Imagine a pregnant woman with anemia. Your guess is as good as mine in terms of what the health of that baby in the woman's womb will look like. Okay, so a baby that is even born now, after a woman has properly planned that pregnancy and spaced it, is likely to be a healthy baby too. So it is important for us to plan. So meaning that family planning is good for both the health of the mother and that of the baby if the pregnancies are properly and well spaced. So in general, families are able to take better care of their children when these pregnancies are well planned in terms of the family planning.
Okay. All right. Thank you for that, sir. Um, what exactly is contraception? Because a lot of people don't even know what contraception is. There's so many different thoughts about contraception, but what is it and what role does it play in effective family planning?
As in what contraception is?
Yes, what is contraception and what role does it play in effective family planning?
All right, thank you very much. Now, if you look at, you brought in towards the family planning and contraceptions.
Mm-hmm.
contraception. Let's break it down into bits so that we can get the message very clearly.
Okay.
Because family planning is a broader term. And why it is a broader term is that it encompasses contraception and other services.
Okay.
Because in family planning, that is where you want to decide if, when, and how many children you want to have. If, when, and how many children you want to have. That's what family planning is all about.
Right.
And inside the family planning, of course, you now have contraception, and of course, you have other services. Contraception is just method that you use to prevent pregnancy. That's contraception on one hand.
Mm-hmm.
While on the other hand, other services that you see in family planning refers to maybe counseling and education, treatment for infertility, prevention of pregnancy, and also the desire for fertility. All of this come under services that goes with family planning. So, in other words, contraception is simply a method that is used to prevent pregnancy. And this method would ultimately help couples to decide when they want to have a baby and how long they want to wait. So it's a form
Right.
of method that actually determines when the pregnancy will come and how long they are going to wait. So it's a method, and it's actually one of the features you see under family planning. So it's a
Mm-hmm.
method under family planning. That's what contraception is all about.
It's all
And there
about.
are different types. There are different types of this contraception.
Yeah,
Maybe as
you can
time
walk us
permits, as
through it.
we talk about them.
Yeah, yeah, I want you to walk us through the major contraceptive methods that we have
Okay.
today and how they work generally.
Okay. All right. Thank you. All right. So for the various methods, remember we said that contraception is actually a method that is actually used to achieve family planning. And for this contraception, which is a method, there are various types. So there are several types of them. All right.
Mm-hmm.
I'll try and break them down in a way so that we'll all be on the same page. Some
Mm-hmm.
people call them barrier method. Now, a very good example of the barrier method is the condom. Now, the
Yeah.
condoms are the one that the condom, we have the female condoms and you have the male condoms that are
Okay.
worn by. Hello, sorry, can you hear me?
Yes, I can hear you now. Yes.
Okay, you have the male condom and you have the female condom. They're actually worn by either the male or the female. Incidentally, this condom does two functions. One, it will prevent pregnancy. How does it prevent pregnancy? Remember, we said it's a barrier method. So it prevents the sperm from
Mhm.
meeting with the egg.
Yeah.
So it creates that barrier. Two is that because there's a barrier there where there's no direct contact, it's also prevent against infections like sexually transmitted infections. So beyond being a barrier method, condoms also, you know, play a role as a form of contraception by making sure that the sperm does not come in contact with the egg. So that is one of the methods. Now, the other method, of course, we know the drawbacks. Some men, they're not too comfortable with that and all of those things. But of course, it's one of the contraceptive methods. So the other contraceptive method there is the family planning pills. These are tablets that are taken daily to prevent pregnancies. They are taken on daily basis to prevent pregnancies. All right. Some of them comes as 28 tablets. There's a 21 of the same color you
Yeah.
take. There's a different serum that you take, but they are usually taken on daily basis. So the other one that you have will now be injections. We've talked about the barrier method, which is the condom. We've talked about the pills, which is the tablet. So the other one is now the injections. These are a form of contraception as well. These are usually given on for a few months. Some are given for 2 months, like the steroids. Some are given for 3 months, okay, depending on the one that the woman is using. It can be for 2 months, it can be for 3 months, and it's actually renewed every 2 or 3 months. The other one you have is the implants. Now, these are like rods. They are put on the arm of the woman. All right. I know it can be one rod, it can be two rods. They are usually placed under the scale of the arm that prevents pregnancy for several years, depending on the rod that was put. It can be for 3 years, it can be for 5 years. It could be on for 3 years, it could be on for 5 years, but they're actually placed under the scale of the arm of that woman. So the other one that we have here is actually the intrauterine devices. The one that we call the IUDs. You have the copper T 380A, for example, and you have the copper T 375. These are all forms of intrauterine devices. Now, these are small devices that are placed in the womb of a woman by trained healthcare
Okay.
provider, like medical doctors. And it takes many years. Like the copper T 380A takes about 10 years, while the copper T 375 takes about 5 years. All right. So depending on which of the intrauterine device that is actually used. Now, the other ones that you have here is the permanent method. No, because before you give contraception to a woman, there are several factors you have to look about, maybe the health of the woman, whether they are done with having children and all of those things. So the other one you have here, apart from the ones I've talked about, are the permanent method. Now, these permanent methods are usually for people who are sure that they do not want to have more children. And each method works in different ways. For example, we can tie the tubes of the woman, which is what we call tubal ligation. All right, where we have to close the tubes of the woman. The tubes of the woman is where the
Okay.
sperm and the egg meets, get fertilized, form an embryo, that's baby, and then comes back to get implanted inside the womb. So that's the fallopian tubes. That could be tied. That's what we call tubal ligation. Now, the same can be done for a man also. Remember, we said that family plan is actually for the couple. It's not just for the
Yeah.
woman alone. It's not a
Yeah.
bad thing. It's for the couple. So for the man, where the sperm is actually transported, okay, we can actually tie that also by a surgical procedure referred to as vasectomy. So a
Okay.
vasectomy can as well be for a man, instead of waiting to do a tubal ligation for a woman. But these are what they are permanent methods. We are sure that they have completed their family size. So these are the people that, so these are the various methods of the contraceptions that are readily available.
Thank you so much, Dr. Ariano. Well, that was very, very exhaustive. Okay. From a medical standpoint, how effective are these? I know you sort of like touched on it, but how effective are they? Because we've seen, whether they're true or not, I don't know. I've not seen firsthand. We've seen people that said they were using contraceptives and the baby came out holding the IUD, the IUD. We've heard of people say, oh, the baby came back holding the tablet. Things that we've heard of people who are on contraceptives and yet they fell pregnant, things like that. So how effective are these? Actually, if they are not the permanent ones like the vasectomy or the tubal, that's tying the tubes, tubal, yeah.
Ligation,
Yes,
ligation.
yes. So what would you, yeah, what's your answer, please?
All right, thank you very much for me. Yes, contraceptive really, when they are used correctly and properly, following the counseling from the doctors now, when they have been, when these patients have been, or this couple have been carefully counseled on how to use it and how to go about the usage, and they are now used correctly. Modern contraceptives are actually very, 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 very effective. In fact, some of these contraceptive methods, like the implants, maybe non plants, for example, and the IUDs, like the copper 380A that I talked about not quite long, can actually prevent these pregnancies for several years. All right. The implants can prevent pregnancy for 5 years. We talked about that. The IUD can prevent pregnancy for like 10 years. We talked about that not quite long, depending on what we are using. If it's copper 380A, all right. The success rate, the effectiveness is as high as more than 99%. So even if there's going to be a failure rate, it's usually less than 1%. So the
Okay.
failure rate is as high as more than 99%. So it's
Yeah.
actually quite effective. It's quite
Okay.
effective, more than 99%.
Okay. I mean, we've seen people that it's been effective for, and I do agree that it's quite effective as long as you use it how you are supposed to use it. Now, to this point where there are new moms breastfeeding moms, or okay, let me go back again. For breastfeeding moms, we hear a lot that there is the safe period. So when they say the safe period is when the mom is breastfeeding for the first 6 months, but then we've seen this safe period failed time and time again. You see women who have 2 month old babies and they are pregnant, or 6 month old babies and they're pregnant again. But then are there certain contraceptive methods that are more suitable for breastfeeding mothers? Can they even go on the, can they start using contraceptives as soon as they've had their baby? Or are there contraceptives for people who have specific health conditions? Because we've also seen that some people experience some side effects from this. So I would like you to just elaborate on that.
Yeah, I think the question you try to find out is whether methods are safe for certain women.
Yeah.
If I can get that correct, is
Yes.
that correct?
Yes.
Okay, thank you. Yes, that is very correct. Some methods are better for certain women. For example, the young women will want to prefer, contraceptive methods like condoms, pills, and implants. That's what they want to prefer. All right. Of course, we understand why the young ones want to prefer something like condoms, for example, maybe because of their age and all of those things. And we just said not quite long that the condoms, apart from being a contraceptive device, it will also prevent against sexually transmitted infection. All right. So you can understand why the young women will tend to, tilt more towards the use of condoms, maybe by extension pills and then implants. Now for breastfeeding mothers, they are breastfeeding and they have, milk to give to the baby. And some of those contraceptives, it shouldn't be anyone that can affect the volume or the quantity of breast milk that is coming from the mother. So rather get a safe contraceptive that will not affect, breast milk secretion. So they are advised to take certain methods that do not affect the breast milk in any way for the breastfeeding mother. And then with women with certain, medical conditions. Of course, those one will be seen by doctors. For example, if a woman had previously been pregnant before and she had venous thromboembolism or what looks like blood clots in her body system, and she's now pregnant for the second time, and she has to be on contraceptive, this type of woman that has had that kind of previous, health condition, or a woman who is hemoglobinopathies, maybe hemoglobin SS, for example, who is now seeing a doctor, they have their choice of contraception has to be carefully selected
Mm-hmm.
based on their medical condition. It has to be carefully selected. All right. It is not every of these contraceptive that they can be on, particularly the ones that are hormone impregnated. So it is the one that we have to select carefully for a woman who had previously had blood clots in her system, or a woman who is pregnant and it's hemoglobin excess. Because of this medical condition, it's their contraceptives must be recommended by the doctor after history has been taken for them and they have been properly examined.
Okay. Thank you so much for that answer. You're so tuned to Women Radio 91.7 FM, the voice of women. This is Radio Doctor. Radio Doctor is broadcast on Women Radio 91.7, and it's your free health consultation program where real doctors advise real people. Again, we are live on YouTube at WFM 917, and you can listen to us on the go via our website www.wfm917.com. Our radio doctor today is Dr. Ewonowo Temidire, the senior registrar in obstetrics and gynecology at Lagos Island Maternity Hospital. He's also the first vice chairman, Nigeria Medical Association, Lagos State. The phone lines are open. You want to call 07000 or 0809155, pardon me, 917917. You can call our toll-free line 0800 1235917. Our text and messages line is 08155 or 0703 1756 537. And this morning, Dr. Wenowo has been consulting for us on family planning and contraception, making informed choices. That's the topic we're talking about today. Okay, Doctor, what's the time? The time is 29 minutes to 11, and this is the Women Radio. My name is Fumi Bangala. Okay, Dr. Wenowo, are there particular factors that individuals should consider when choosing a contraceptive method? I ask this question because body is different to body. I was going to say that in Yoruba. Araya to Sarah. um and some, like, a lot of people don't know what best works for them. Sh- should they go see it? I mean, they should go see a doctor, but what factors should they consider before choosing the contraceptive method that would suit their needs?
Yes, thank you very much, Fumi. Yeah, there are several factors that a woman we have to consider before a
Mm-hmm.
decision is taken for a woman that wants to be on contraceptives. For example, the age of a woman is actually very important. Okay, the age of a woman is very important in terms of contraceptive for that woman.
Okay.
Two, we want to know also whether the woman has actually, completed the family size, because once a woman has actually considered completed her family size, sorry, completed her family size, we are sure of we'll be thinking of a particular, contraceptive method to offer to that woman. Now, the medical condition or the medical history that a woman has is actually very important. Remember that these drugs have their own side effects also. For example, if a woman is maybe on the weak side, for example, and some of these contraceptives, one of the side effects would be weight gain. For that kind of woman, the contraceptive you have to consider for that woman would not be, oh, this woman is a little bit on the weak side. So this particular contraception may not be ideal for her. So you consider the age of the woman, you consider whether the woman has completed her family size, and you look at the medical condition of this woman. If you put this together, it's going to guide you as a doctor on the man. So it is offered really on an individualized basis, putting into
Mm-hmm.
consideration the health of the woman, whether they completed the family size, and the physique of that woman.
Yeah, I actually agree with you, because I remember after my first daughter, my friend and I decided to go get a particular contraceptive. It worked for me. I had no complaints, but she had to take hers out maybe 6 weeks or 3 months after. I don't recall what timeline was, because she was reacting badly to it. Interestingly, I did not even, to be fair, I didn't even go to ask which one was going to be better for me, because I sort of knew, I knew that I didn't want the IUD. I didn't want anything. I knew I didn't want that. I also knew that the injection wasn't going to work for me, because I was already, even though I used to like injection, I was like, nah, I can't. I also knew that the tablets were not going to work for me, because I run away from any form of tablets. In fact, I don't know how my children came out right, because I cannot tell you, Dr. Iwanowa, that I was taking my drugs per second. I think I would just do anyhow, and then they would tell me, "Oh, your blood is less. I will not take to restore, and then I'll forget again." So I knew that wasn't going to work for me. And the easiest one, so I sort of like diagnosed myself. I'm not saying do that for yourself. It was just for me, and thankfully it has worked for me. All these years. But like what Dr. Ewonawa said, you need to go to the hospital and let the doctor speak to you and know which one will work for you as an individual. Dr. Onowo, let's talk about side effects. I just mentioned the side effect that my friend, had gone through with the same implant on that we both used. But what are the if someone experiences side effects from a contraceptive method, what steps should they take? And when should they seek medical advice?
Yes, thank you very much, Fumi. Yes. Yeah, the contraceptive, this is one of the things that we do normally when they come to for family planning. I want to offer contraception to them. We ask a couple of questions. That's what we call history taking. We examine them, because by the time we take that history from them and we examine them, that will already guide us as clinicians and doctors, what is likely to be the best for this woman, because they have their side effects. But of course, what anyone should do once they notice is that if someone notices the side effects, the first thing is not to panic. It's not to panic at all. That person should not panic. Okay, they could observe this thing for a few days if it's not getting worse. And if they notice that it's getting worse, then they will have to visit their doctors. Now,
Okay.
usually when they visit, they will have to see their doctor who has offered them that method of contraception. And once they see the doctors, what are those things that the doctor will even do? The first thing is that the doctor may still will listen to her again, examine her. The doctor might just offer her reassurance because part of the things that we do when they are offered this contraceptive method is that we'll tell them some things to expect. All right. So because we know some things can happen, and those things are very minimal, and there's nothing to worry about. So that will be explained to them. But if they now come back again and so fast and whatever they have said is still in line with part of the counseling we had offered them, how to giving them that contraceptive method, the doctor may have to still reassure them in many, that's what happens. But in some cases also, when the doctor now, examine this woman and now realize that no, I may have to switch from this method to another method so that the woman can now get a better method that suits her, that is better for her. That will be determined by the doctor. So two things usually happens. The doctor either reassure the woman or may have to switch to another method of contraception for this
Okay.
woman. But more importantly, the woman should not panic. She just observe for a few days and then see the doctors.
Okay. Thank you so much for that. Is it safe for somebody to change from one contraceptive method to another, or should they wait a while? Is there a proper way to do so?
Yes, it is actually very safe. It is safe for you to move from one method of contraception to the other, especially if you are not too comfortable with the one that you are. You can actually, do that switch. However, it is best to do this with the help of your, the professional, the doctor, so that there is no gap. Because at the time you are switching, if you left it and if you are not on anyone, and before you now want to opt for another one, you probably would have gotten pregnant. But because that means the purpose is defeated. So if you notice that you're not comfortable with a particular contraceptive method, just approach your, healthcare provider, your doctors, who will now guide you appropriately and help you to switch to another method of contraception. So it is safe, very safe to do that.
Okay, awesome. The Shawana is saying that it is very, very safe to change contraceptive, but speak to your doctor. Now, this one, I don't even know if it's a myth, but I think even from when I was younger, I used to hear it a lot that when you use contraceptive, it can cause infertility. I would dare say that a lot of people, that's one of the reasons why a lot of people don't want to use contraceptive, because they believe that actually if they still want to have children, that is going to be much more difficult for them to have children. They will suffer with infertility if they decide to go off the contraceptive and want to try for a baby. Is that true or false? Or is it just a matter of the body adjusting?
Yes, the thing about contraception is that no more often in our clinical practice, when we have seen a woman and we have been able to manage her and we manage the pregnancy, and eventually the woman goes home with her baby, so the woman delivers successfully because that is always the goal of every obstetrician. Once the woman gets pregnant, she manages her in the pregnancy, she delivers successfully, both mother and baby they are well and alive. You will discharge that woman to the postnatal clinic with the baby. At the postnatal clinic, you will still want to look at the baby and be sure that the immunization schedule is going on as planned, and the woman too is doing very well after delivery because you want to examine the womb, you want to examine the other parts of the body to be sure that the woman is, coping well after, delivery. Now, more importantly, you will not send the woman when you have when the woman is not leaving the postnatal clinic, you send the woman to family planning clinic.
Okay.
You'll be surprised, for me. There are some women, when they hear for the very first time that they're going to family planning, they'll now look at you like, "Wait, family planning as in, how many children do I have that I'm going to family planning?"
Family
You
planning,
understand?
yes.
So,
Yes.
so I just want to relate that to the question that you asked now, because
Mhm.
there's this lot of myths, misconception about family planning, because something that family planning is actually something that is dangerous, that is harmful to their health. Something that inability for them not to even conceive again. That is infertility. And women now start worrying about about that. But let's make this point very clear that family planning is very safe, it's not dangerous. And family
Mm-hmm.
planning cannot make a woman not to get pregnant again. What family planning intends to achieve is to make sure that a woman space out the children that she wants to have, when and how she wants to have those children. That is
Okay.
what family planning is. And when it's time for the woman to have her next pregnancy, all she needs to do is to take out the contraceptive method that she's on. And once she take out that contraceptive method that she's on, ovulation will resume. And once ovulation resume almost immediately, she'll get pregnant again. So family planning is just there for you to have that period not to get pregnant. Once you are ready for pregnancy and you remove the family planning, you are good to go. You get pregnant. So family planning is not harmful, it's not dangerous, and should not prevent you from getting pregnant when you are ready to get pregnant. It will not.
Thank you so much for that. Thank you. I mean, I might be one drop in the ocean, but I know that when I wanted to have children, I took out the contraceptive, and I think the next month or so, and I've seen people as well who've done that. I think that the myth is so heavy, and there's also this thing of the mind where your mind begins to play tricks on you, and that's where you really really need to work on your mind, because if you feel like, oh, it's because you use family planning that you are now not having children, it has a way of messing with your body. That one, I don't have to be a doctor to say that one. So you need to just be able to know that, look, like what Dr. Bruno said, it's for your own good, this contraception, right? You can't be having children back to back to back to back, and then you now be going about borrowing money because you want to take care of said children. Let's just apply wisdom to all that we do. Another concern, Dr. Wono, is that contraception encourages promiscuity. How will you address this misconception from a from a medical standpoint? And I've seen this over, oh, kufeloyu, that's why. So when, and because of that, even married women are like, they don't want to, because I don't understand how people think, but that's just what it is. What would you say? How would you address this?
Thank you very much, Fumi. Yes, I just mind when you raise this question. Uh, yes, I would ask if you are talking based on knowledge too, because this is something that was I've heard somewhere. Of course, like I said, I'm
Oh,
not
yeah.
unaware of it. So I agree with you, and I agree with that question that you asked also. So, in the real sense of it, contraception does not in any way encourages promiscuity. It does not. Family planning is about a responsible decision making and protecting one's health. It is not in any way meant to, encourage or promote indecent or irresponsible behavior or attitude. So, contraception does not in any way whatsoever. There's no evidence in support of that to suggest that it encourages promiscuity. It does not. So
Okay.
it's a responsible decision, and it's a responsible decision, and it's meant to protect the health of the woman and that of the couple. That's
Thank
my
you so
response to that.
much. You heard it from the doctor, senior registrar for that matter. He has said it like, this is like, let's not, you don't need contraceptive to be promiscuous. You do at all, at all, at all. And we need to start, disabusing ourselves of that mentality that, oh, it is promiscuous people that use contraception. And we've seen that married women, like, when pregnancies come, they're the ones who say, oh, they don't want the pregnancies even more than single people. So the way to avoid that pregnancy that you don't want is to do contraception. And Dr. Ewano has been gracious enough to mention all the contraceptives that are available at your disposal, whether it's temporary one or whether it's permanent one, when it comes to this. Now, when it comes to family planning decision, how can couples approach this in a healthy and respectful way? Because we've seen situations where the woman is like, oh, I want family planning and the man says, no, you're not doing family planning. Or maybe it's the man that says, oh, I want family planning, and the man says no. Because some people just feel like it is an infringement of their personal body or things like that. So, what is the approach that couples can take in this kind of situation? Should they go to the doctor? Should they have it one on one? Should they give each other time to adjust to the idea of it? What would you say?
Okay, yeah, thank you once again for me. Ideally, when it comes to the issue of family planning decisions, ideally, both parties should be involved. Both parties should talk, the man and the woman. They should talk openly, and if, of course, they need to respect the opinion of each other. It's a joint decision. Both of them must come together and agree on the family planning together because it's about their family. It's about their future. If you look at it in the real sense of it. So when it comes to decision making of family planning, the partners should come together and talk sincerely, openly with respect for each other. Because that decision they are going to take is all about their family, is all about their future. So both of them should actually talk openly and with sincerity.
Simple and I mean, that's very, very short and sweet. They should both talk about it. It's very, very true because I mean, we've also seen where women went behind their husbands' backs, to get contraceptive, and the man was wondering, is it that I cannot perform, that there's no other baby coming? And then they find out that maybe she had contraceptive and then it caused a whole thing. So it's important that there's transparency, there's openness. And if you feel like you need the help of a medical practitioner, please do so, just so that, the doctor can hear, your husband, your spouse can hear it from somebody who is certified in that field. Okay, what role do men play in supporting responsible family planning? And I'm asking this question because I believe strongly that it's supposed to be the man that should be doing family planning, because a man is laughing at me, because a man can get 5 different women pregnant at the same time as long as they're all ovulating. A woman can only get pregnant once in her cycle. A man can give multiple women pregnant. She doesn't even have to be ovulating. She be ovulation is what, 5 days. From the first day to the fifth day, we will see women that have gotten pregnant that they were not on their ovulation. Whereas miracle, I don't even know what it is because the sperm can stay long in the woman. So, Dr. Ewanova, I said
Yeah.
all this to ask you that what is the role that men should play when it comes in supporting responsible family planning? I think they should just go for vasectomy when if they are done with children, but that's just my belief. That they're the one. That's because it's either condoms or vasectomy. But you're the doctor, I'm not the doctor. Yes. Go ahead, sir.
Thank you very much, Fumi. Let me just build on the premise that you established before I quickly respond to that. That truly a man can actually get 5 women pregnant at the same time if they are ovulating. You can even extend it. They can get 10 women pregnant at the same time if these 10 women are actually ovulating. Yes, let me go extend that for you. But let us come back home slightly. And that's the fact that, you see, pregnancy too comes with its own attendant complications. Okay? But incidentally, it's the woman that is going to carry that pregnancy.
Yeah.
Now, the implication of that is that when it comes to the health implication, the health hazard, the complications, and all of those, and severe mobility, it tells on the health of that woman. And that is why it will not be out of place, really, in the instance of it. If a woman decides to assess, family plan and say, look, my health is much more important. These children that I have my life, let God give me a long life to take good care of them. So if the woman
Yes.
decides to do otherwise, the woman will say, no, me, I will not do otherwise. Let me take care of our own children. So if the woman can assess family planning, is not out of place because of the complications that comes with pregnancy itself in the first place, especially if they are not properly monitored. That said, so what is now the role of man in family planning? Men has a lot of role to play, a very big important role to play. In fact, one of them is supporting their partners, because if a woman has if a woman has offered herself for family planning, they need the support and the cooperation of that man. That man needs to support that woman in that decision of family planning. Remember, we said this is joint decision. It's a decision where couples ought to come together and talk openly and talk sincerely with respect, mutual respect for each other. For that reason, that man, one of the roles that he has to do is to actually offer support to that woman in times of decision that the woman has taken to assess family planning or contraception. Now, taking part in family planning discussion, of course, for example, the use of condoms, and all of those things, they need to sit down together. The man needs to show some understanding, okay, and of course, helping also to make some responsible decisions about the family size. Because if the man has said that, so we want 3 children, the man has to come in also to play that role, also in supporting that man. Okay,
Yeah.
well, really? Oh, let's settle for 3 children, So they both determine the family size, not in the sense that a woman comes and say, "Oh, I want to have 3 children. The last pregnancy, my BP was high," and the man said, "No, I want 7 children." No, 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 no. It's a joint decision. You must come together. You need to support that woman. You need to give support to her as a man in terms of the family size, the number of children you want to have in that family. And in all of this, by the time we now work together to support that woman in that decision making and all of those things, it's the best thing. And both parties, when they are now involved, it's good for that family. So the man has that role to play to support that woman, to support
Yeah.
that decision. It's a family decision, it's a joint decision, and the man must be saying, being part of that. So the man has a big role to play in that.
Thank you so much, Dr. Owano. I think on that note, we'll give it a rest because we have run out of time. But I just want to say thank you so much for coming on the program today. Today was very, very interesting because I mean, this is something that's affecting Nigerians, and then we're seeing that people can't afford to take care of their children, and then it's causing fight in the home because money will always cause fight if there's not enough money at home. So we want to say thank you for doing justice to today's topic. Maybe I think that we should have a part two of this one so we can really, really delve into other parts that affects this. But thank you so much for coming on today's free consultation on Radio Doctor on Women Radio this morning. Thank you so much, sir.
Yeah, thank you very much for having me. And good morning, Nigerians. And bye from here.
Okay, Doctor. Radio Doctor is on Women Radio Mondays through Fridays, 10 a.m. So you want to join us tomorrow for another edition of Radio Doctor. Today's Radio Doctor was Dr. Ewanowo Timdire, a senior registrar in obstetrics and gynecology at the Lagos Island Maternity Hospital. He's also the first vice chairman, Nigeria Medical Association, Lagos State. With that being said, do have a healthy day. Many thanks to the producer, Asha Sani, and Benjamin for producing me in the studio. Many thanks to the executive producer, Tom Okiwale Shonaya. My name is Fumi Bangala. Do have, like I said, a healthy day. Bye for now.